But you said something interesting, that there's a gap in conventional medicine, right? And specifically as it regards to women's health, specifically HRT.
HRT it's hormone replacement therapy, meaning that you are not making your hormones anymore, and so they have to be replaced. When we get older and we lose our hormones, we don't feel well, and the only thing really that can make us feel better is to replace those hormones, and instead women get given antidepressants and birth control pills, and what you really need is bioidentical hormone replacement therapy.
Women's health industry is massively underserved, and it's because of this lack of understanding, and their quality of life significantly declines really fast once this, hormonal cascade begins to go down.
Basically, and it doesn't mean that having no testosterone is normal. No, what that means is that nobody has been concerned about women's health or women's sexuality at all. And so nobody has really looked into like how much testosterone women are supposed to have, and then they just give you the lower limit of normal as like basically 0, which is ridiculous, but that is just evidence of how little people care about women's health.
Hey guys, welcome to another edition of Beyond Biohacking Brothers, where we explore all things about health optimization, longevity, biohacking, and beyond. And today we're really excited to bring and be joined by a true trailblazer in women's health and MHI's very own Dr. Amy Wecker.
Yes.
Doc, thank you so much for being here with us today. We are so excited because this is super long overdue. So I just wanted to kind of introduce you to our public. Dr. Wecker is not only a trailblazer, but an expert in hormone replacement therapy, women's health, and integrative medicine. With an infectious disease background, she's dedicated her career to understanding the complexities of female physiology and has developed a personalized approach to helping women optimize their health at every stage of life. From menopause to the challenges of hormonal imbalances, Dr. Wacker is at the forefront of providing effective solutions to optimize women's hormonal health. And today we'll have a whole overview about women's health. Man, am I excited.
You forgot to say that she's a peptide expert.
That too.
And a junkie herself. You have taken every module from A4M in regards to peptides.
I have taken.
You're one of the most advanced people on peptide.
For
I
sure.
have taken every module and also experimented heavily on myself, as we do.
As we all do, right? All the time. If you were to see our internal chat of how we talk about peptides, it's pretty fun, scary, and exciting.
Yeah, so Doc, you went to medical school and had formal training, and then you ventured out into this realm of health optimization, biohacking, and I just wanted to kind of ask so that people know what was your personal experience, and what would you mark as a decisive moment that gave you the courage to venture out? And I mean courage because most doctors that get traditionally trained, they kind of get stuck in that mechanism of traditional medicine. And so to venture out into, into a field that from traditional perspective could be almost considered bogus or quack. What was kind of like your personal experience, and what made you decide to kind of, go down the rabbit hole of biohacking and health optimization?
Okay, well, it's an interesting question, and I did actually have a pivotal experience that pushed me in that direction. So I was in my late 30s and happily practicing infectious diseases. I was a partner in a big private group living in Fort Myers, and I was actually just out at a bar with my ex-husband one night, and out of the blue, I started having horrible abdominal cramps, and then I started having profound vaginal bleeding, and it was not time for my period, and it just started, and I had this like profound vaginal bleeding for a few days. And so I went to see my conventionally trained OBGYN, of course, and they got me right in because I'm a doctor, VIP. And he basically just told me, hey, you're fine. He did an ultrasound and he said, you don't have cancer, you're fine. Okay, I was 37 years old. I didn't think that I had cancer, but also I was not fine. And so for the next few months, then I started having these crazy heavy periods and I couldn't even go to yoga. Like I would have blood running down my leg by the end of the yoga class. I mean, it was really terrible. And again, he didn't do any blood work and he just completely dismissed me. So I was at a party one night and I ran into a friend of mine who was practicing functional gynecology and I curbsided her. I said, I hate to do this to you at a party, but I really think I can be potentially dying and let me explain to you what's going on. So she said, and I had been on birth control pills at that point for a long time because I didn't want to have a baby. So she said, you know, you're on birth control pills for so long. When that happens, sometimes your uterus can kind of turn on you. It can really affect the uterine lining and you can have some abnormal proliferation. Why don't you come on into my office and let's see what's going on? And so I went to see her and she actually did a whole workup on me, did blood work, and I got off the birth control pill. She found out that I had low testosterone. She started replacing my testosterone. Turns out I was also hypothyroid. I have Hashimoto's. She diagnosed my Hashimoto's. She did a few simple things and I felt better. And I was back to being my healthy, normal self. And so that really got me interested in, I don't want to call it alternative medicine. I'm going to call it functional medicine.
Yep, that's exactly what it
is. And
that's
so
exactly what it is.
got me really interested in it. And I had always tried to be as holistic as I possibly could. But there are gaps in the traditional medical training. And when I was practicing general ID, infectious diseases in the office, I would do some internal medicine and I would see these middle-aged women, usually like at the end of a long, complicated infection. They would ask me if I would be their primary care physician and I would say yes. And then they would say, well, I'm just so tired and I just didn't know what to do. Like, I think if you ask probably just 100 random people off the street, what's the biggest thing you've noticed if you've gotten older? Most people will tell you, oh, I feel tired. Okay, but why, right? And so, I would check the thyroid. And if it looked okay, I would say, well, I don't know. I guess you're just going to be tired. And I look back on that now and I cringe. Like, I can't believe I said that to these women, but it's true. I mean, the tools that you get are just so limited. So then a few years after that really sparked my interest. And then a few years after that, we were introduced by a mutual friend and
thank God.
Yes. And and Miguel was looking for a female physician,
practitioner.
And that was kind of the catalyst. And then after we met, I went home that night and I signed up for the fellowship at A4M, and
it was the calling.
The rest is history. The rest is history.
It's funny.
It's been a long time.
It's been a long time. That
started 2016 or something? Yeah, 2016.
Like 8 years, 9 years.
And then you went your way. And then we came back together. It was very interesting, the road.
Yeah.
Happy to have you with us.
But what's funny, what you just mentioned is a classic story of what most men and women, especially women, because it's, that's one of the conversations that we were having throughout this week is, that the optimization space is usually male dominated, right? And it's very hard. And, we had a conversation with you and you were kind of the catalyst where we said, hey, we need to separate our departments. Like, we are different species, different creatures, and we need to be talked to differently. We need to be treated differently. I mean, your hands-on approach exceeds anything that I've ever seen in the optimization space. But what's really interesting to me is that you were sort of gaslighted, by a doctor who said, you're fine. It's all in your head.
Right. And I was getting VIP medical care because
And
I'm
you're
a doctor.
Yeah.
So, we're colleagues, right? And, I call the office, come in immediately. Anything for you, Dr. Wecker. And then he's like, you're fine.
You're fine.
And I'm like, I am definitely not fine. Like, I understand that I'm not dying of cancer, but also I am not okay.
Yeah. And
which is great. I love that because it really taught you, I believe, that it's not just based on labs, it's based on symptoms, right?
Yeah.
Because most people are, you're fine, go home. It's like, no, I'm not fine, right? So you're very tuned into the symptoms of the patient and you actually listen to the patient.
Well,
right?
and to that point, first of all, anybody watching, if you've gone through a similar experience, this happens to doctors too.
Right.
Yeah. So, but to what Miguel was saying is it becomes increasingly more difficult for a man to treat a woman because we cannot relate to the symptoms that women go through and vice versa, right? Like, I don't know what a heavy period feels like. I couldn't even imagine bleeding in my yoga class, right? And so a lot of times what I find, and this is where we got like really sort of empathetic about women was that for us, it almost sounds like just complaining. And it's really not. Like, this is not in your head. You women, I've seen some of your notes and some of the symptomatology that I see in women. I'm like, oh my God, poor human being. You know, I couldn't imagine dealing with this. So, you know, to have a powerful woman who's gone through the process herself and now is helping other people is an amazing thing. But I wanted to kind of touch upon
and to recognize you for that, it takes a whole different set of skills to treat women, to be honest. Men are easy. We're regulated by diurnal rhythms. Get blood work 48 hours before ejaculation and just get it in the morning, right? Women, you got to time it between the 19, 20, 21 day. You can't do this. You can't, like, it's just so many restrictions in order for you to get the sweet spot, right?
But also, you know, and I want to kind of pounce on the fact of the courage, because you were a doctor. You know, that comes with a certain sense of prestige and accomplishment, and then you reach this sort of like wall where you're like, oh my God, I don't know anything. I need to really explore down this path, and you've grown into such a, you know, versatile doctor. So, you know, I just wanted to honor you for your courage to venture out.
Thank you.
But, you know, you said something interesting, that there's a gap in conventional medicine, right? And specifically as it regards to women's health, specifically HRT.
Well, and specifically wellness. So, I mean, look, if something if something horrible happens to you, conventional medicine really is pretty amazing, right? Like
acute
medicine. Acute medicine, and, you know, like, if you get
blew out an eye or an arm,
yes,
you're in a hospital,
you know, emergency care is amazing, and a lot of advances are incredible. I mean, I still do practice infectious diseases, and the advances in HIV treatment have just been unbelievable. But there are gaps specifically when it comes to wellness. We've gotten pretty good at, there are gaps also in treating disease, but in general, we've gotten pretty good at treating a lot of different diseases. But in terms of just keeping people well, there are gaps, and like preventative care, wellness care.
Huge. And so
thank God it's growing.
That's one of the things that I wanted to pounce on, and this is a long-winded question, so forgive me. So, you know, because for women, HRT is still a bit of a mystery, you know, with a lot of conflicting opinions in the media. And so, you know, specifically the lingering effects of the estrogen hysteria from the early 2000s and the misinformation surrounding HRT. And you know, what's funny is that despite the walkbacks and the fine print over the years in the research, we've seen a generation of women, over 20 million, deprived of critical hormone therapy. And today, confusion still reigns. So many women are hesitant about starting HRT due to these concerns about side effects, risks, potential, you know, cancer and all that stuff. So how do you address those concerns, and what are some of the safety protocols and benefits that make HRT a safe and effective treatment for most women?
Well, first of all, like, let me give a little overview of the HRT and why it's so important. So HRT it's hormone replacement therapy, meaning that you are not making your hormones anymore, and so they have to be replaced, right? So we're not really adding anything that's not supposed to be there in the first place. We're just replacing it. And you have to think about this. We make vast quantities of everything until we're about 25. And then things start to decline, and not everything declines at the same rate, but 25 is kind of when it starts. And so generally we feel more or less fine until our mid-30s. And then we start to notice very slowly things are not the same as they used to be. And by the time we're in our 40s, things are definitely not the same as they used to be, right? We start to feel tired. The recovery goes down. This is for everybody. And then for women, we start to get into perimenopause, right? So we stop sleeping, we start sweating at night, the sex drive goes away, on and on and on. And so if you think about it, if you go back through really most of history, we didn't live that long. So as a woman, you would have many children, 13, 14, 15 children, and then you die. I mean, if you would make it to 50, you know, very, very, very old, right? And so there was not really much of a life after menopause. But now I think we're expecting to live a long time. I don't know, 90, 100, 120, forever.
Well,
I mean, who knows,
CDC,
right?
the average American is living up to 78 years of age today.
So you're going to then basically either spend half your life in a steady decline, or you're not.
Well, the World Health Organization estimates that the average person spends the last 20% of their health in poor health.
Yeah. So I mean, to me, it's a hard no. I mean, there's no way. So I'm turning 50 in a few months.
And
so
you look amazing.
Thank you. Thank you. So that's it.
You can kick ass doing handstands.
She could do better handstands. She could do better handstands than me, for sure.
Yeah.
So, I mean, it's a milestone, 50, right? And like, I don't want to spend the next 50 years in a steady decline until I die. And so at a certain point, I mean, you either put the you decide to put the chemicals back into your body that you're not making anymore, or you just have to accept the natural consequences of aging. So in the early 2000s, there was a study called the Women's Health Initiative. And basically, it was a study of a large group of women, and they looked at the effects of two synthetic hormones, Premarin and Provera, which are made from pregnant horse urine. And they looked basically at the safety profiles of these hormones, at the effects, at the side effects. And there was a small subgroup of women that they said, oh no, the hormones are giving an increased risk of breast cancer. And it turns out that it was statistically flawed. But at that point, the headlines had already come out, and then the whole thing got sensationalized. Oh my goodness, these hormones cause breast cancer. And from this small group of individuals, which again, the statistics turn out to be totally flawed, but from that, it was extrapolated that no women should ever receive any hormones ever for any reason, which is crazy. And it really set women back about 20 years, because when we get older and we lose our hormones, we don't feel well. And the only thing really that can make us feel better is to replace those hormones. And instead, women get given antidepressants and birth control pills. And what you really need is bioidentical hormone replacement therapy.
Well, to add to that, to echo on that, the Women's Health Initiative, when it was placed in 2002, I actually looked at the statistics, and it showed that 80% of postmenopausal women were taking hormone replacement therapy. And after the widespread fear from that flawed study, it dropped to 1.2% of women.
Oh, wow.
Yes. And then how we explain it was because of these synthetic hormones. So I know you just said hormone replacement therapy, but let's redefine that. It's bioidentical hormone replacement therapy. So the ones that they use, like the fake estrogen is Premarin. Which is it called?
Yeah.
So Premarin has, if you look, it comes from horse urine, and it has 5 different urines. It has E1, E2, E3, but then it has ubiquitin. I forgot the other two, but it's a form of estrogen that we don't produce. And I'm assuming that's where something went wrong, because the body couldn't identify with the urine or hormones, estrogen hormones of a horse.
Yes, the way that I like to explain to my patients the difference between bioidentical hormones and synthetic hormones, I say it's the difference between eating an apple and eating a piece of apple flavored candy. So maybe they have like a similar flavor, but they're definitely very different, and they're doing different things inside your body. So bioidentical hormones are hormones that have a chemical structure that is identical to the chemical structure of the hormones that we make. So they can be, they make a lot of them out of yams, but they can also be totally synthetic, but they are bioidentical because it's the chemical structure is the same as our chemical structure, whereas synthetic hormones are referred to as synthetics, are hormones that have a chemical structure that's different from the chemical structure of the hormones that we make. Like there's all kinds of synthetic progestins like that are in birth control pills and so on. But actually, that's not bioidentical progesterone. And again, you can make progesterone out of different things. Like it could be made totally synthetically, but it still is a bioidentical hormone because of the chemical structure.
Let me echo that. Mine is a little more geeky, but if you break down the word bio, it means living organism, and it's identical to what we produce. So bioidentical hormones are identical to what we produce. And when people say, "Oh no, but it's synthetically made," we synthesize molecules every day, make compounds, and then make proteins, right? We're synthesizing proteins every day. So yes, although these medications may be synthetic, they are bioidentical to what our bodies make. So they are totally safe. Now you do have synthetic pharmaceuticals that have deviated from its natural state by adding a extra molecule or hydrogen or carbon or whatever it is to it that makes it unique. And that's why they can patent it. And that's what we mean by synthetic. It's no longer matching what nature is like. But bioidentical hormones match exactly the molecular structure as what we produce.
Yes, excellent. Very well said. Right. Yeah. And with the synthetics, like they interact with the receptors in a different way than our own natural hormones or the bioidentical hormones that we're taking. And so those interactions can produce various side effects and whatnot. And that's why we do really prefer to use bioidenticals. And there are, we use compounded hormones.
No, we only use bioidenticals.
Well, right. I'm saying we use compounded hormones here, but there's plenty of commercial products also that are totally fine that are also bioidentical. I think the key, it's not necessarily if it's compounded or if it's commercial, if it's bioidentical or if it's not.
And maybe, I don't know, I don't want to jump over the questions, Carl, but maybe you can
go
do it.
ahead.
No, but maybe I'll leave it later. I don't know if it's in here because I haven't looked at the questions. But in regards to the administration delivery form that we're using, which is very different than what's traditionally out there, which is, troches, creams, pellets. We're using this patented technology that you put in your mouth. And I remember I sent you a batch. I'm like, try this out, see how it works. And you were like, wow, this stuff is amazing, right? Now you're an injectable tea, right? I mean, could I disclose that?
Yeah, sure,
okay,
yes.
But
I'm an open book, I'll disclose all the things that my 50-year-old
again, we keep upgrading, right? And the injectable tea, pound per pound, I'm an injectable tea, so high five. We're both injectables. But I would like for you to maybe touch on how effective is this patented rapid dissolve technology versus putting a cream that you can pass on to your kids, so the troches that you can get an infection, and depending on the vascularity state of your body, you can suck up the hormones from that pellet much faster than the average person.
So, okay, yeah.
Did I skip over a question? Or
You kind of skipped over a point, but don't worry about it. I'll go back to it.
So basically, I think there's a lot of different delivery systems. Okay, so with the commercial products, of course, we have oral products. It turns out that oral estrogens and oral androgens, which would include testosterone, are not great for the liver. So we try to avoid that. With progesterone, oral is fine. I know a lot of people are taking commercial oral progesterone, and that's totally fine. Okay, then in the functional medicine world, people use a lot of creams. I'm not against the creams, but honestly, they're not the best. And I was on testosterone cream myself for a while, and you have to rub really vigorously. You never really know if you're rubbing it vigorously enough because you have to drive it through the epidermis into the dermis. They can be really messy. And again, you do have a chance of transferring it to someone else in the household. And they're just, people are not, you generally not crazy about them because they are kind of messy.
So I think it's important to mention that there's different bases of HRT creams, right? You have lipoderm, you have HRT base, which is sort of more micronized, so it's absorbed a lot better than your traditional gel that gets approved by insurance, which is terrible for absorption. And just like how we have injectables, coconut, based, or sesame seed based,
MCT.
or MCT, sesame, cottonseed. There are different forms that are more absorbable.
Yes,
so.
but it's hard to get the dosing consistent, I think. And so, I'm not really a huge fan. So the pharmacy that we work with, they make us these rapid dissolve tabs, and they're pretty amazing. You just stick the tablet underneath your tongue and let it dissolve. And I know there is some old thinking that no, sublingual is really oral, but actually no, these tablets are really sublingual, and the pharmacy has all the studies and the data. And I think maybe,
and it shows up on the blood work too.
Yeah, like maybe 20, 30 years ago, sublingual was oral, but not with these tablets. And so the tablets are really great. And again, super, super easy. And then of course we have injectable drugs. So I'll be honest, I'm not like dogmatic, and, I'm not really against anything. I'm not like anti-pellet, but also I'm not really crazy about them, because the thing with the pellets is that basically you have to figure it out, and if you're wrong, that's it. And I actually had one woman tell me she was overdosed on the pellet, and there's nothing you can do. You have to just kind of wait it out, and it can be months. And this one woman told me, she said she was masturbating 12 times a day, and she just could not get relief, and like that it was just so uncomfortable for her. It was like an itch that you can't scratch. And again, you have to just kind of wait it out, because the pellets last around 4 months ish.
Well, it's important to note that depending on the vascularity state of the individual, if you're super fit, and especially if you work out your butt a lot, the blood vessels, once you heal, they will absorb that the pellet a lot faster than somebody who has more fat and is kind of what do you say when you don't work out? Sedentary, right? So that's important, because I looked into the research that depending on your vascularity will depend on how fast you absorb it. So you cannot have bioremorse with a pellet.
Well, and the great point, and you just explained the extreme on the too much side, right? Well, if you have too much, what do? I mean, you're screwed, right? There's no buyer's remorse. Yeah. And if there's too little, then you're also screwed because you're not getting the benefit and you have to wait another 4 months to.
Or no, we've seen that they have to supplement with additional hormones while they're doing it. While the one is going down, they have to find a way to find that midpoint, which doesn't make any sense.
So the tablets are great. And another great option is injectable testosterone. Yes, injectable testosterone for women. So I will be totally honest. So I'll tell you personally, I was on testosterone cream for a few years and it was fine, like until it wasn't. And then you guys turned me on to the tablets, and I was on these sublingual tablets also for a while. And the thing is, at a certain point, you kind of reach a dose where I feel like past a certain dose, then you do run into the risk of basically virilizing effects, which would like masculinizing effects, which would basically be facial hair
Hirsutism.
and hirsutism. So facial hair and an enlarged clitoris. And so at a certain, I don't have any hard limits with the tablets or the injectables, but I always explain that, hey, if we go above this dose, you are kind of getting into a risky territory. If it's okay with you, it's okay with me, but before forewarned, right? So another great option is the injectable testosterone. And so again, I also tried this because you guys said, hey, give it a try. And I said, okay, I'll try it. And
safe.
It's great. So this is just regular injectable testosterone. We just use a tiny little amount. And the nice thing about the injectable, it works better. So it definitely gives you more of a kick in terms of energy and sex drive. And the nice thing too, it basically gives you kind of the benefits of pellets, except that you can adjust the dose yourself. So let's say you give yourself too much, okay, but then the effects are going to wear off after a few days, not after a few months. And then if you don't give yourself enough, you can always give yourself more the next week because you're injecting yourself every week and you control it. So I think that's a great option.
That's the key point, is the control of the dose, right? You're always in control, and that's important not only as a medical provider, but also, in treating patients to be able to manipulate the dose on the fly to prevent any side effects or, too much or too little.
At MHI, we recognize the importance of mental sharpness and managing stress. That's why we're thrilled to introduce NewCalm.
NewCalm offers an extraordinary system designed to naturally calm your body and your mind. By harnessing key principles in neuroscience and state-of-the-art technology, NewCalm uses electrical signals to send essential nutrients to your brain, providing a drug-free solution to effectively combat stress, improve sleep, enhance recovery, and mental performance.
Visit the MHI Recommend section on our website to discover more about NewCalm and get your exclusive discount code today. For now, stay healthy
And God bless.
Now, so we kind of jumped a little bit because we've talked a little bit about some of the scary things that could happen with HRT, but I actually want to give the counter, and just backing up a little bit on your point of this concept that after 40, you should just accept entropy and accept that, hey, you're just getting older, right? Which we refuse. But this is how, and correct me if I'm wrong, but I like to, so when I speak to women on the intake, I like to kind of explain to them why. Why should they consider this, and why should they, hey, at least get a lab and have a consultation? Because here's what we got, right? So the good thing, I think, well, let me just say this. In an oversimplified manner, menopause is literally a stage in a woman's life where they literally begin to lose 95% of their hormones in a 5-year span of time, roughly, right? So when you think about this steep decline, which men is a lot more like insidious and progressive, whereas women just kind of fall off of a cliff, from a hormonal perspective. And so when that happens, this is why women will have these very violent reactions in menopause or perimenopause, like the mood swings, the night sweats, the hot flashes.
The husband think that the wife is going crazy, and they're not. It's just a hormonal issue.
Right. The vaginal dryness, the skin dryness, the painful intercourse, uncontrolled weight gain, hair loss. I mean, it's just a lot of symptomatology that happens real fast, where some women can't even recognize themselves. I mean, I just read a crazy statistic that 70% of divorces are filed by women over 40. Right?
It's women
divorcing
the man over 40.
And it's a relatable issue where they go through these changes super fast. But, so that's the symptomatology phase. But I think that's just a tip of the iceberg, because the good thing now is that, you mentioned this 20-year gap in women's health, but we have 50 years worth of clinical evidence that strongly shows us that if a woman does nothing, and this is the message, if you do nothing, if a woman does nothing to regulate that hormone balance back to a youthful state, then we got the incidence of disease is crazy. I mean, we're talking about metabolic disease, right? Which includes insulin resistance, diabetes, hypertension, and the gateway to all of these other ones, which is, aggressive forms of cardiovascular and heart disease, cancers, osteoporosis, dementia, Parkinson's, Alzheimer's. I mean, the list goes on. And the incidence of these things that I just mentioned as a result of low hormone balance is nearly 50 to 80%. I mean, that's a statistic that I read on the research. So for all women that are considering, first of all, it's not all in your head, when you're going through this, number one. Number two, you need to find a medical practitioner that understands this and does this on her personal life, like Dr. Wacker, who went through this herself, but also consider the risks, because we talked a lot about longevity and lifespan. You mentioned that we're now living longer, but what about the health span? What about the quality of life? And this is why we're doing a big push this year, because I think the women's health industry is massively underserved, and it's because of this lack of understanding, and their quality of life significantly declines really fast once this hormonal cascade begins to go down. So with that said, I mean, what are some of your specific strategies in your intake, and what are the symptomatology that you look for, and how do you sort of, put together an individualized care for women and regarding HRT?